In today's economy, every ad dollar counts. That's why performance marketers are turning to Rokt Ads to reach 1.1 billion unique customers globally in the transaction moment. When they're completing a purchase online, you only pay when customers engage. Learn more at rokt.com/emarketer. That's rokt.com/emarketer. Hey gang, it's Monday, March 23rd. Beth, Rajiv, and listeners, welcome to Behind the Numbers, the marketer podcast made possible by Rokt. I'm Marcus, and join me for today's conversation. We have two of our senior digital health analysts with us, living in Pennsylvania. Joining us, Beth Snyder-Bulick. Welcome to the show.
Hey Marcus, thanks for having me.
Yes, indeed.
Happy to be here.
We're also joined, indeed, we're also joined by, living in New Jersey, we're also joined by Rajiv Leventhal.
Hey Marcus, how are you?
Hello, sir. Very good. How are you?
I am good.
Fantastic. Today's fact. So I thought this was quite appropriate, this fact of the day, given what we're talking about. Where did the term snake oil salesman come from? So we're talking about health influencers, and some of them are telling the truth, some of them not so much, whether on purpose or accidentally. And it seems as though health misinformation has quite a long history. It goes back to this term snake oil salesman, which originated in the 19th century. So it started when Chinese railroad workers brought authentic anti-inflammatory omega-3 rich Chinese water snake oil over and used it for joint pain. But then there was an American entrepreneur, if you can call them that, Clark Stanley, who rebranded this and was selling fake, non-effective, ineffective rattlesnake oil remedies. There was a 1916 to 17 federal investigation determined that Stanley's snake oil had nothing to do with snakes and was in fact just mineral oil. And so that's where we get the term snake oil salesman.
Always comes back to healthcare, huh?
Apparently. Today's real topic is social media's growing role in healthcare decisions. All right, so Beth, 55% of American adults say they use social media to access health information and advice, at least occasionally, according to KFF, Kaiser Family Foundation. These shares increase when asking young adults and people of color. But why? Why are people turning to social media for health advice?
Yeah, I mean, it's a great question, but I would say, sort of at its base or at the base level, it's just like people turn to their social networks for advice about beauty trends or fashion. They're also looking to those same social networks for advice and information about health conditions or health and wellness trends or even products. Of course, health conditions are more serious than beauty products, of course, and that's part of the reason why they're looking to physicians and patient influencers most. So physicians, professionals with a medical degree, nurses, and others. And then also on the patient side, people who have the same condition that they might have, or, that a family member might have, and they're going through the same health journey. Mm-hmm. We also know that to a lesser extent, celebrities are being followed by people for healthcare information. That's about 24% according to our survey. So about a quarter of people are following celebrities who offer health information. A lot of the times when you see a celebrity offering health information or health advice, it's around a loved one or themselves having that condition as well. So they fall into the patient category as well.
Right. Okay, there's lots of different groups of people here. We've got celebrities, we've got physicians, we've got people with the condition, we've just got other people who are talking about the condition. But they're on social media, and social media is something that we do a lot every day. Our forecasting team says that we're on social media about somewhere between an hour and a half to 2 hours every single day. And so part of this, Rajiv, isn't it just they're turning to social media for health advice because it's convenient? It's just like there was Americans were asked what they liked most about getting news on social media, just regular news, and they overwhelmingly said the convenience, according to Pew Research Center. So part of this is just they're there already.
Right. Yeah. And technology in general, of course, has, kind of bridged the gap between uh, consumers and expert opinions or professional information, and healthcare is really no different. And I think
Mm.
in addition to what Beth said at the top, another big piece is that the healthcare system isn't always accessible for everybody. It's that often varies depending on your situation in terms of where you live and what insurance coverage you have, factors that drive people to technology and to online tools to look up information, engage with others. And in an ideal world, that type of information I think would supplement what your regular
Hmm.
physician or what a medical professional tells you from their expert opinion and experience. But that's not always the case. But like it can be a thing where it sort of overpowers the traditional access to the medical system.
Hmm.
In many parts of the country, you can't get an appointment with a specialist or even a primary care doctor for a long time. Even if you could, it might require taking time off of work or transportation or some sort of other
Right.
financial piece that might not be realistic or reasonable. And this turns people to influencers and really just to information in general, via digital channels such as social media.
There's a number to back that up. There's a great CNET article by Anna Graggett, and she was noting a 2023 study by the National Association of Community Health Centers and American Academy of Family Physicians found over 100 million Americans, so a third of people, face barriers to accessing primary care. That's doubled over the last 12 years.
Yeah. And
So,
medical professionals or whether it's like healthcare and pharmaceutical brands, they know this, and
mhm,
they need to be meeting people on the digital channels where they're spending more and
Right.
more and more time, and social
yeah,
media is just one example of that.
yeah. Um, there's also a bunch of other problems. There's fallen reimbursement rates. There's the admin challenges facing smaller practices. There's family medicine being one of the lower paying specialties, and students less inclined to get involved there. So there's a host of reasons why it's harder to get access to a smaller local GP, and why people are turning to the people online. Beth, one of the findings from your recent research on this that struck me was that one of the main reasons, which it seems to be also one of the main reasons people go to the doctor, but one of the main reasons people would turn these people on social media for health advice was empathy.
Yeah, there's an Edelman does an annual trust study, and the reason why people turn to or to influence health influencers who aren't healthcare professionals, I should
Right.
say, the top
Hmm.
reason was because they're looking for empathy.
Yeah.
Um,
More so than having direct experience with a specific health issue. They
right.
wanted
Although
someone to listen.
that was one of the top things too.
It
Yeah.
was high. It was
Yeah.
high. Yes. Yes. It was
So
only
that would
just
be the
ahead of
more
it.
of the patient experience, that sort of you're in my shoes too, talk to me.
Yeah.
But the
Yeah.
empathy is a really interesting part of this. And it could be, as Rajiv said, there's time pressured, and then there's fewer physicians, so you're spending less time with
Hmm.
patients. And so it may not be a lack of, purely a lack of empathy on the healthcare professionals' part, but that they're
Right.
time crunch. They just don't
Yeah.
have the amount of time to sit and talk. Whereas you can go online and find a healthcare influencer who's going through your same thing. And it could be a doctor as well who's talking about it from their professional point of view.
Hmm.
Here's what this condition is, here's what it means, here's what you should be thinking about. I don't think that a lot of influencers give outright advice, just because everyone's cautious about that. Certainly physicians don't give advice on social media, but general health guidelines and those sorts of things. And then the
Yeah.
patients are talking about their own journey. Actually, you're probably more likely to get patients talking about the kind of drugs they're taking, or giving advice,
Hmm.
because they don't follow those same ethical
Yeah.
codes.
And
Yeah.
related
Please.
quickly to the empathy piece, I think is people who feel that their symptoms have either gone misdiagnosed or misunderstood or unaddressed somehow, which happens a lot, in especially for certain symptoms and conditions, whether that's women's health or weight loss or mental health, or maybe even issues that are highly sensitive and you're not comfortable really talking to a doctor who you might not know really well.
Good point.
Well, now you have, different types of communities online of people, whether they're patients or physicians who are specifically talking about and discussing and bringing to the forefront these types of maybe previously stigmatized issues or misdiagnosed unaddressed issues. So you kind of have this whole other world where you can get access to that information other than being maybe a little bit embarrassed and that might be the best word, but just a little bit hesitant to go to the doctor to talk about a specific issue or symptom.
Yeah. Yeah, I was trying to think through why you would go to the doctor because I was saying to Beth, and you, Rajiv, as well, like why would people turn to social media? It just doesn't make any sense to me. But then there were so many reasons that you guys brought up, which got me thinking as to why. And one of them we're talking about. One is that before, if you could get a 15-minute quick appointment with a doctor a month down the road, you'd be lucky. And with social media and influencers, you can spend a lot more time with them whenever you pull your phone out, and kind of feel this kind of parasocial relationship with these folks. Um, and part of that, I think, which I thought was a really good point being made, this is from Jessica B. Steyer, who she holds a doctorate in public health and she's executive director of Science Literacy Lab. She was saying that health influencer videos can feel very empowering as well. She said what wellness influencers do very well is make it seem like if you do X, you will be healthier. It makes people feel as though they have a ton of control over their health, and that's empowering. So I thought that was a really good point.
Mhm.
Um,
Beth made a good point I think at the top though, around like it's often not personalized advice because the influencer or
mm,
person you're engaged with on social doesn't have all of like your lab history and what's been wrong with you and what's your family history and your genetics looks like. So a lot of it is often that general wellness advice, public health messaging, things like that. Try this product. So I think it's important to just kind of have the disclaimer, or not even the disclaimer, but important to keep in mind that it's not a one-to-one replacement for doctors.
yeah,
It's a tool that should provide some hopefully will provide good reliable health information, but still not the same type of
yeah.
advice that your doctor could give.
I found something that was speaking to that kind of overgeneralized health messaging piece. There's a study by the University of Vienna published in the National Library of Medicine, noting that health expert content creators highlighted the complex role of social media influencers in public health, acknowledging their potential to promote positive health behaviors, whilst also noting the risks associated with the spread of inaccurate or oversimplified health messaging. The findings emphasize the urgent need to broaden health communication research to address not only misinformation, but also overgeneralized health messaging, which can be equally as detrimental. Um, so we talked about kind of the groups of health influencers. There was some research, I believe this is in your report as well, Beth, looking at who they are. So doctors or other medical professionals, that's most of them, or the biggest share. Then you've got kind of medical people with an interest in the medical condition. Then you've got celebrities, that's seeing a lot of growth. Caregivers is another group. But who are they? Do we have some examples, Beth, of some popular health influencers?
Yeah, I mean, first of all, I would say a health influencer can be anyone, right? Anyone with a social media account who talks about health issues and has a following.
Right.
We do talk about, there's nano or micro influencers
Mhm.
who may have small groups of following, just a couple of thousand. I think those are more common around things like rare conditions. There's a couple that have, there's a young man named James Parkin. He's a YouTuber and a Facebooker who has he calls it Live in Life DMD style. So he has a muscular dystrophy condition called Duchenne muscular dystrophy, which only affects males. And he talks about living life DMD style. And he only has a couple of thousand followers. But I think when you're talking about some of the popular, well-known healthcare influencers, one of my favorites is Dr. Sandra Lee. She's the Dr. Pimple Popper. She's a dermatologist. She has TV shows on TLC and Lifetime. She has 4.6 million Instagram followers. And she does talk about her dermatology cases and the pimple popping, of course, and the behind the scenes of her show. But she also has several sponsorships. She works for Sun Pharma, she's got an acne campaign that's active with them. UCB Pharma as well, for a particular condition. This is a rare condition called a hidradenitis suppurativa, which is a really serious cystic skin condition that happens more often in women of color. So there are those partnerships, and I know, and sometimes people know about them and sometimes they don't, with those big well-known influencers. I think you know more often because they're very upfront. They have to be, it says, sponsored or an ad tag to them. There's another one, another very popular healthcare influencer named Dr. Zach Rubin. I actually follow him. He's a pediatric allergist and a clinical immunologist. He came to prominence during the COVID the COVID era, I guess we're gonna call it that. So anyway, he has 2 million TikTok and Instagram followers. I follow him because my kids have allergies and food allergies, but also I really like the way that he explains things in medical terms, current events, in a really relatable way. He's very empathetic. He does debunk misinformation, but he's really kind and relatable. And I think I'm probably typical of people who follow health influencers, right? I follow them for a reason. My kids have allergies, but also I can understand his content. He's talks to me in an empathetic, kind way. The thing that everybody said, right? They want empathy.
Yeah. Yeah. Rajiv, who are some of the ones that stand out for you?
Yeah, and I kind of think like the key point is that really anybody can be an influencer. So you have these medical professionals who have specialized areas that they discuss. They have maybe brand deals with drug company, medicine companies that create products for these conditions. And then you have celebrities like who you wouldn't even think are remotely involved with healthcare. Like Tom Brady is an influencer. And you might think like, how? Well, he's got a brand connection with a fitness company now. He's the chief wellness officer at this company called EMED, that's essentially like a health management and telehealth company that's involved in weight loss drugs. So you might think, well, what is he influencing? Well, if someone as famous as Tom Brady, who almost everyone in the world knows, is promoting something, is discussing something, that you're an influencer, right? And then I kind of think of like influencers. I think this sort of market really emerged, at least in the healthcare space, during the pandemic, during the COVID pandemic. And I think of people like Dr. Sanjay Gupta, who was really present and visible on CNN and on his social media accounts as someone who really wanted to set the record straight with what he perceived was misinformation around vaccines and COVID drugs. So things like that, treatments that you should take if you have COVID, like a lot of, as we don't have to go back, how much misinformation was spreading so rampantly during that time. So I think those are some of the people that are most well known because it's not tied to a product or even a disease. It's really just disseminating reliable, trustworthy, evidence-based medical information to people who badly need to hear it. Again, there's no necessarily like endorsement there or even talking about like a specialized condition. So it really falls in different buckets, like, patients or medical professionals who are talking about a particular health issue, celebrities who probably have some sort of brand deal, and then honestly, like those who are just doing a public good and using their experience and expertise to spread reliable medical information to the public.
Yeah. Some of
Yeah,
these
that's a really good
guys,
point.
please. No, no,
Yeah,
please.
I just want to say that because when you talk about rare conditions or even a typical health condition, say migraine, you may not know anybody else who has migraine. So you don't know like what are some good things to do. So you go to find a health influencer who also has migraine, and then you can join that community or just find that person and listen to what they're doing. I sit in the dark. I took sugar out of my diet, those kinds of things. It doesn't necessarily, yeah, as Rajiv said, doesn't have to be straight medical advice or from big platforms. It's that, again, we're back to seeking community, seeking that empathy and
Yeah.
reassurance when you have a health condition.
A lot of people, quite a few influencers have pretty big followings. There's one, Dr. Mike
Mm,
Vashovsky,
yeah.
Dr. Mike, board certified family medical physician, over 29 million social media followers. And that can be it can be a good thing if the information that you're providing is accurate. It can be a bad thing if it's not so much. There was this group as in 2021, the Center for Countering Digital Hate found there was 12 anti-vaxxers, also known as the Disinformation Dozen, responsible for 65% of anti-vaccine content on Facebook and Twitter. This was after they analyzed over 800,000 posts on the platforms. So it could be a very small amount of people reaching a ton of other people with information. And so that brings me to the question of how how hard is it to disseminate what is good information and what's bad? And also to that point, Beth, how much do people actually trust the information they're hearing from health influencers compared to someone like a physician or
So
who's not on social media, I should say, because some physicians are.
sure. I mean, we do know that physicians are the number one trusted source for healthcare, which translates to health influencers who are physicians as well.
Mhm.
But in real life, you trust your doctor most. But the interesting thing is the people who they trust second is their family and friends, right? So
Mhm.
it's again an extension of that family and friends on social. You may not know the person directly, but they're in your network. You followed them for sometimes you consider them a friend.
Yeah, there's Rajiv, it's interesting because there's this paradoxes with a lot of things, but particularly with people's online behavior. One of them is the social media news paradox, where when it comes to getting news on social media, according to Pew Research, more than half Americans say they get news there, but also the majority of people who get news there say they don't trust the news they encounter
Right.
on these platforms. What's your take on trusting social media or trusting healthcare influencers?
Yeah, it's the same thing. I mean, I have a theory, and it might even just be like a common sentiment at this point that people like to say they don't trust information on social media, but they do, because they continue to engage with it. And I'm not saying they trust all of it, but they trust enough of it to go back and continue to interact with it, and they act on it. I mean, a big section in Best Report and report I have coming up is how people act on online health information,
Hmm.
social media being a big part of that. So um, often it does come, or you do, the result is, maybe purchasing a product or asking a doctor about a medication or taking some other, or maybe it's just, conducting further online research, which is probably the most common type of action taken after seeing an ad on social media, after seeing some social media medical information, some content, a video, what have you. I think it does inspire it does inspire action. And just going back to the trust, people again, when people are polled about this, they'll say they don't trust health information. KFF had on social. KFF had a good poll late last year, looking at all these different, asking people about all these different platforms, people who are already on these platforms. And while younger people are a little bit more likely to say that they do trust health information on social than older people, pretty much every platform got worse views than they got worse perceptions. They got positive ones in terms of like the
Hmm.
health information on there. So uh, more people said they trust none of the health information on social than people who say they trust most of it. And that's on
Yeah.
TikTok, YouTube, Reddit, Facebook, Instagram, right? So, and
Hmm.
X. So pretty much every platform, every
Yeah.
major platform. So why is that? I think it's people are wary of the misinformation for sure, but it's it's almost like a psychological thing. Like if you're asked about trusting internet content, social media content, especially something as serious as health, you're gonna be like, no, I know enough to kind of spot out and discern like the good information from the bad. But in reality, I think it's a much more gray area than that.
Yeah. And the stakes are so much higher here, right? Like there's this one example I was reading about Stephanie Alice Baker, Associate Professor of Sociology at the City St. George's University of London, analyzed 200 videos in a study last August. She found 81% of cancer cure videos on TikTok featured false or misleading advice. And so when we were talking about what to cover for this episode, Beth, I was saying to you, Where's the good here? Like what? And we were decided to phrase the question this way: which areas of the health influencer space raise the fewest concerns?
So I think it's back to that sort of trust and the medical professionals and the posts and comments. Our study found that 55% of people trust medical professional health related posts and comments.
Hmm.
Dr. Social Media was also the most trusted. Boomers especially trust Dr. Social Media content, 61%. And back again to the patients, half of people who follow another patient who has the same condition that they do or trust them. I'm sorry, 1/3 of them say they trust them.
Mm-hmm.
Half of them follow someone who has a similar condition. But still, I mean, that's really high, right? So we're back to that who you trust, who you believe, like Rajiv just said, like you understand, you have enough of an understanding about your health, about the healthcare system that you feel like you can discern. So I think that I do trust I trust this physician, I trust these patients. It's almost like it's real life on social media, right? Who do you trust? You trust your doctor in person, you trust your friends and family, you trust other patients, other people like you. It translates to the healthcare influencers who are putting out content online.
Yeah. Let's end here. At the end of your report, you have some recommendations for healthcare and pharma marketers. What's your number one?
So we know that influencers, aren't some niche strategy. Most marketers are already thinking about it, growing their plans. 3/4 of brands say they're going to increase their influencer budgets. But I think the focus is shifting from these kind of one-off campaigns, hiring someone who has, say, a heart condition to represent you, to talk about your medicine, or even just to talk about getting screened for a heart condition on social media, and instead building relationships over time. So brands, marketers are sort of shifting from that relevant one-off campaign to more like, okay, let's build a long-term relationship with you and then also with your audience.
Yeah. Yeah. Rajiv, anything to add here?
Yeah, I mean, I'm not sure if it's in the report, but thinking through recommendations, it's really understanding the core issues and challenges that people have with the healthcare system and why they're turning to social media to to fill that gap, right? So a lot of it's around access and cost. So Reddit's a good example of it might not be, it certainly is not like an influencer heavy platform, as it relates to healthcare and pharma specifically, but it could be an opportunity to kind of look at what people are discussing around like this medication. They're interacting with people in a community that have maybe a similar condition with them as them, or they're taking a similar treatment on a similar medication journey, but there's insurance issues, there's cost issues, there's access issues. Understanding those and then trying to develop a marketing strategy or even an influencer strategy to try to address those concerns, I think is something that marketers across healthcare and pharma need to be thinking about.
Yeah. Many, many more recommendations in the full report that Beth just put out, Healthcare Influencers and Creators 2026. If you're a Pro Plus subscriber, emarketer.com is where you need to head. Otherwise, there's a link, of course, in the show notes. And just one more time to promote this article by Anna Grager. It's a long form piece. It's absolutely brilliant from CNET. How wellness influencers spreading misinformation signals a deeper problem within our healthcare system. So check that out as well. I'll throw a link in the show notes if we can. That's all we have time for today's episode, though. Thank you so much to my guests. Thank you first to Beth.
Thank you, Marcus. It's great to be here.
And of course to Rajiv.
Thanks, Marcus.
Yes, indeed. And thanks to the whole production crew and to everyone for listening in. So Behind the Numbers, an eMarketer podcast made possible by Rokt. Make sure you subscribe and follow and leave a rating and review if you can. Susie will be here Wednesday with more Reimagining Retail. I hope I get to hang out with you on Friday.